Maybe. I don't know.
Right,
Don't worry
everybody's
about
here
it.
and it's.
Sporting the logo here.
I know, but they can't hear us. But where's the,
Okay,
they can?
now they can.
We'll see.
Well, no, can they hear us with masks on?
Oh, I don't know about that part.
Do you want to do a roll call or do you want to just launch right into it? I can see who's present and not, so.
It's for.
No, I'll just
Just-
pull my glasses off. Are you ready to go?
yes, sir.
All right, gentlemen, it's a little bit after, and lady, I'm sorry, it's a little bit after 6 o'clock. Thank you for being here early. We're going to begin our staff and elected official only discussion about a mask ordinance and other mask or PPE related topics, whatever they may be. So anyway, that's what we're going to do. We are going to do the pledge of allegiance. I think that's important every time we meet. Chandra is going to dispense with the roll call because she can see you all. So let's stand for the pledge and then we'll get started. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, there is only, oh wait, is Karen on? I want to make sure she's,
She isn't here yet.
okay. Just want to make sure that we all understand what we're doing and why we're doing it. I wanted a chance for all of the elected officials and staff to have a frank conversation amongst ourselves, not a private conversation, but be able to speak amongst ourselves and discuss the issues about masking or not masking. And so the public is, this is a Zoom call, the public is, it's being live streamed, but the public will not be able to speak. The only person that will speak other than staff and elected officials is, I've invited Karen Peak to speak, but I don't see her, she hasn't logged on yet. So when she does log on, I will just stop and then let her speak so that she can go on with whatever she's doing this evening. So, because I don't know how long we'll be here. But having said that, just one little bit of news, you probably heard it, but Branson voted this afternoon to have a mask ordinance. So just FYI, that's not intended to influence anybody. It's just news. It was an afternoon meeting. So we'll go ahead and who would like to start just by asking questions or stating an opinion, or, you know, this is an open forum and this is the only agenda. So I'll leave it open. Okay, anybody? Nathan's getting ready. Well, Bruce, are you?
Sure.
I saw your box light up, so I didn't know if you were getting ready to speak.
Can you hear me?
Yes, sir. We can.
Okay. Well, Ozark School District sent out an email dated July 28 at 6:10 p.m. And they said that they received confirmation. This is addressed to parents, so I'm not reading anything that's private.
Right.
They said that they received confirmation from the Christian County Health Department on July 28 that 3 students tested positive for COVID-19. These students attended prom on Tuesday, July 21st, 2020. The prom was masked. That isn't an indication that the theory of masking is incorrect. I think for our country, the scientific consensus is that it may work with social distancing to help stop the spread of the disease. And the prom was, as I said, masked. What it does highlight is the significance of this problem in this community. For so long now, we've sat and watched other areas of the country deal with this virus. And some areas were deeply affected. Other areas were not. Our area was not. But we're no longer on the sidelines. It's here. The numbers are going the wrong way. And it's hitting our households. And it has the potential of hitting the schools. And the schools are opening. I think that the policy for schools opening is based on the fact that parents, well, first of all, they want their children educated in a manner that is effective. And unless you're trained in homeschooling and prepared for it, I think the thought is that the schools can do a better job, but also allows people to go to work because daycare is so expensive. So it's important. This issue is important for the schools, and for the schools to operate, they're going to need to operate in a community that is taking this pandemic seriously. Every decision made by political subdivision in this state and others counts. So for me, this isn't something that we can any longer sit back and think this is somebody else's problem. This isn't going to impact us. It's impacting us. It's impacting us today. And so my hope is that as we discuss it, that we consider that this isn't something that we can kick the can down the road. The sooner a decision is made, the better for our community. So that's how I'd like to open the discussion.
All right, so let me ask you a question. I'm understanding you that you're in favor of the mask ordinance or just in favor of wearing masks?
Well, I want to hear what other people have to say.
Okay.
I mean,
Well, that's fair.
but as far as whether I think that masks are effective, I mean, there I have to rely on scientific consensus. The consensus for our country in the scientific community is that they are effective when combined with social distancing. And that, I mean, you can go from website to website, from the Mayo to Harvard or whatever medical schools or medical systems, I mean, they all say the same thing. So, I mean, I think so you asked whether I think that masks are effective. Yeah, I think they are. But that's based on what the scientific consensus is.
No, I wasn't trying to put you on the spot. I just, because we could be here for much longer than 6 times, however you're talking. I just wanted to know how you feel in general, and you're not ready to give that final opinion, and you don't even have to do that. I was just wanting to understand. So you're in favor of masking, but gonna hold on a final opinion. Of course, don't have to do anything till Monday, so I get it. I want to hear all sides of it from the Board of Aldermen. I certainly lean towards a mask ordinance, but I also want to hear arguments from the other side before committing fully. And
I'm so sorry, you're just gonna have to go without seeing it for a second.
okay, can they hear us?
Uh-huh.
Okay. We're trying to,
They don't know we're doing anything, they think everything's the same.
all right. Sam, do you know, Karen Peak is not on?
I'm working on that.
Oh, you're working on it. Oh, okay. Wasn't aware of that. Okay. Okay. Anybody else would like to chime in? Sam is trying to get Karen Peak on board. She's not online yet, but she will be, I hope so. And I cannot see you all because Sam's working on something to get Karen on board. So who would like to speak
I
up?
would, Your Honor.
Okay, Nathan.
I have some concerns along the same lines as what Mr. Galloway said. When we shut everything down back in March, that was right before spring break. So the school went on spring break, then they extended spring break by a week, and then the kids never went back. So at no point during this pandemic have our kids been together in a way that they're going to be in about a month.
Yeah.
And that's really been, in my opinion, kind of a missing component that's kept this at bay. Our kids will get it and they will pass it back and forth from family to family, through the school, through the bus. We've got kids at different ages, different schools. I mean, a couple families could literally pass that virus through the entire city, through the entire school district. And I know the school doesn't have a mask requirement right now. That may change. But even if they did, that's only one layer of protection. If the kids mask and the adults don't, or vice versa, it doesn't work. It's only going to work when we're all in unison. I hate the idea of having a requirement, but I'm certainly in favor of this. You know that. I wish personal responsibility was an option. Personal responsibility was an option back when we lifted all the restrictions, when we phased out and COVID grew out of control. If personal responsibility worked, it would have done so already. And so I know that there's going to be some issues with this. I want to talk to the chief later. I hope he's there. I have some questions for him, and I hope we can get Dr. Peak. I'd like to talk to her as well, but that's kind of where I'm starting my thoughts at tonight anyway.
Well, Justin is here, but he's in the council chambers where there are some people that are here listening. So, but we can get him in here to answer questions shortly. So
yeah, so not immediately, but I do have some questions. So at some point, if we could bring him in, I'd like that.
oh yeah, definitely, we'll do. All right, I don't see Karen yet. So who else would like to speak? We're not limited to who says what or for how long. So this is our chance to talk amongst ourselves. Jason?
I'll go, yeah. So I'm opposed to the mandate. I'm not a big fan of government trying to govern the behavior of individuals. This isn't criminal behavior. You know, this is free choice, you know, especially when it comes to these type of issues that have restrictions on person's liberty or opinion. I mean, I don't think anybody's coming to me and telling me that masks are a cure, that they're going to keep the virus or keeping people who have masks from getting the virus. I think there's a dispute as to, a genuine dispute as to how helpful it would be. And I certainly recognize that the majority, or at least 50% of our citizens, oppose a mandatory mask. I also have been told that we like to follow the lead of Nixa, our sister city in Christian County, and they chose 6-0 not to enforce a mask mandate. I am, by nature, a limited government type of individual. I think government should be one that educates and advises and recommends, but not one that dictates and demands or controls. And really what we're talking about is punishing our citizens for not choosing behavior that we think is most appropriate. And I just have a hesitancy to punish my neighbors if they think differently than I. Personally, I wear a mask when I can, and personally, I think it does help to some degree, but I'm not at the point where I'm wanting to compel or force others to adhere to that logic, because the next step would then be compelling people to do vaccines. And then the next step may be compelling people to take tests to determine who has the virus. And it's a slippery slope that we get into. You know, we're asking, you're asking the board here to do more than the governor's recommending. I mean, we would be enacting an ordinance that is contrary to what the state government is asking us to follow. It's contrary to what the federal government's asking us to do. It's contrary to the Surgeon General's instructions. So I don't know why we as a city would want to take on a more restrictive approach than that we are giving from our state and federal governments. So I certainly oppose the mandate, and I would vote against it.
Jason, let me just make one comment here. I'll take issue with only one thing you said, because I know your stance on this, and I respect that.
Sure.
But we're not asking anything. What we are planning on doing is simply, or what I have wanted to do is simply put this on the table for discussion and a vote, so we make a decision. And that's all. If there is an ordinance, and there is someone that has agreed, one of you aldermen has agreed to sponsor it, the ordinance or the bill will say, yes, there will be one. But that does not come from me. That does not come from the staff as far as what our preference is. That is to get it on the table and discuss it.
Okay.
And so just want to clarify that. Now, everybody will have a chance to speak, but I see that Karen has logged on, and she is the only person that is not staff or an elected official that is being allowed to speak tonight. So I invited her because she is very concerned about this, and probably distraught is another word for it. So I think it's only fair that we hear her opinion. So Karen, you're next. Can you hear me? And are you ready to go?
Yeah, I can hear you. Can you hear me okay?
Yes, ma'am, you're good. So
Okay, I'm sorry for the delay. I don't really know what happened, but that second code that you all gave me worked out well for me, obviously. So thank you for inviting me to your meeting this evening. I just want to share a little bit of information from the standpoint of the health department. First of all, we have 248 cases in Christian County at this point in time. Well, logged as of today anyway. And so there's more cases coming in as we're speaking right at the moment. We're currently monitoring 94 cases in our county, which is one of the highest numbers that we've monitored since March 17th, when we got our first case. Just since July the 2nd, we've got 192 of those 248 cases. So I'd like to point out that for the first 3.5 months, we had that stay-at-home order in place during the majority of that time period. During that time, we only had 54 cases. So again, as you can see, in not even a month's time period, now that we don't have anything in place, we've got 192 cases. So I know we're feeling the same impact that all of the counties around us are as well, including Greene County. Our concern with this is that we're gonna, at some point, overwhelm our healthcare system, which I don't know the numbers that the hospitals are dealing with at this point in time, because that's not in my jurisdiction. So I really don't follow those. I just keep track of what's going on in Christian County. So I can tell you that we've had 5 individuals out of that 248 that were hospitalized. One of those individuals did die of COVID-19. 4 of those individuals were on ventilators in the hospital. We currently have 1 individual on a ventilator at the hospital as we're speaking, and they're not doing very well. So the purpose of public health is really to prevent any infections, diseases, or death. So if we can even prevent 1 death, that's what we're here for. So as far as the health department standpoint, we would support a mandatory face mask ordinance, just because doing nothing at this point is not helping us. We are asking people to wear their face mask. We formed this task force in Christian County, and we're putting all kinds of information out there, trying to educate the community to please wear your face mask to slow the spread. Because again, what's going to happen if we don't, our economy is going to continue to decline, because the state of Missouri is spending a lot of money trying to control this virus. We're seeing the impact in our own community as well. I would like to point out, I just read that Taney County actually passed their mandated face mask order. Greene County, as we know, has 2. And so our county is in the middle of both of those. I know we have businesses out there that are fighting, saying that they don't want to wear that face mask and they don't want their patrons to do that. So if you think of the situation now at hand, since we're in the middle of 2 of the counties that actually have the mandated face mask order, it's what we're going to do here is bring more COVID into our community, because those individuals will potentially come here and spend their money and, come to our Walmarts, our stores, to our restaurants because they don't want to wear their mask. But then we have at least half of our population here as well that want to be protected. So if we're not going to protect them, we have to think about those individuals are probably going to go to Taney County and Greene County or other counties that have mandated face mask orders, and they're going to give their business to them. So to me, that's not a really good trade-off, that we're getting all of the COVID-19 cases and then they're getting our individuals that like to keep themselves safe. I just would like to see the numbers go down. Unfortunately, they're not. We're reporting 25 and 30 cases at a time whenever we do report those. So there's no vaccine for this virus. There's no treatment at this point that works 100%. And again, we know that face masks don't work 100% either. But at this point, that's our best option to try, because what we're doing now, just requesting or asking people to do it, it's not working. So I do ask for your support to pass that ordinance so that maybe we don't continue to overwhelm our healthcare system. I know Dr. Trotman is working hard to try to keep enough resources in the Springfield area, but at some given time, we may see those numbers increase, and then we may have our own family members that are not able to get into the hospital, to be on a ventilator, or to have a chance at surviving this. So that's the stance that we take from the health department. Again, if we can prevent even one illness or one death, that's what we're here for. So I'd like to ask, are there any questions for me? I know that there were a few that came through my email earlier. So are there any questions?
Yeah, Mr. Smith, go ahead.
Thank you, Your Honor. Thank you, Dr. Peak, for being here. I appreciate that very much so. I know you've got a lot on your plate, and I appreciate you taking the time to do it. I've got a few questions, and I may have more, but I've got a few. And I don't know what the criteria to use is, so I'm going to use this criteria. Using your number of 248 tested positive, when you say cases, I'm assuming you're saying tested positive. And the Christian County population of 2019, then that would say since March 18th, I believe, when we started tracking this, we've had 0.00279% of our population that is tested positive.
Mm-hmm.
If that number, and again, we can argue there's a better number because I don't know what the number is, but if that number, it would be the health department's request that we require everyone to wear a mask, then what would the number need to be for us to say we've done enough, we can take off the mask?
They're really in this situation, there's no number that we can tie to this, honestly. We're not really just looking at the death rates here. We're looking at resources that are available or the lack of treatment. So if we can slow the spread, that's what we want to do. Unfortunately, it's not just Christian County that's in this situation, it's a pandemic. So we have other counties around us as well, but there's not a number that you can tie to something like this.
Well, there has to be, from my perspective, there has to be, and here's why. And it's not your fault, but in general, the American public do not trust government because we said shut down for 2 weeks to not overwhelm the hospitals. And then we kept moving the goalpost. I'm talking in general, I'm not talking specific Ozark Christian County and so forth, but just in general across the nation. We kept moving the goalpost. And then there, just like the mask orders in place right now, Indiana's is only for 30 days. Oh gosh, I just lost, but most of them are going for 90 days. That's an arbitrary number. It means nothing.
Yeah.
If there's a reason for us to wear masks now, there has to be a reason for when we can say enough is enough and turn it off. And I understand the difficulty in that, but we also do not have a resource issue at this point. So there ought to be somebody smart. Again, I'm not putting this on you, but there ought to be somebody smart enough to figure out the math to say at what infection rate, based upon the hospitalization rate and the mortality rate, whatever, there ought to be somebody smart enough in math to know when that number will cause us to have a resource issue. And all I see personally right now is just wear a mask, which I agree. I 21 years in the Air Force medical world. My wife's always been in transplant or the ICUs or our cardiology as a nurse practitioner. We wear masks. I mean, we're not arguing the benefit of wearing mask, but to have an open-ended wear mask, but we can't tell you when you can stop because we don't know, and we're just going to politically arbitrarily pick out a number and say, okay, this is 30 days, 90 days, whatever, we're going to stop wearing masks, is not acceptable to me.
Yeah, I think it may have to be like the stay-at-home order was, where we have to assess the situation as it comes. So we wouldn't just look at Christian County. Again, it would be the counties that are surrounding us. It would be our state. It would be globally. Are those numbers coming down or not? They should, if everybody is wearing a mask, as they should, appropriately, consistently. You know, really, this is our only option at this point, other than close back down or, again, deplete our resources.
Well,
And
but then if we're depleting our resources, there's got to be a number when we deplete our resources. I mean, I can tell you all day long we'll deplete resources, but if I can't back that up,
yeah,
it's meaningless to me. And again,
Yeah.
I know that's not your problem per se, and I'm
Exactly.
not trying to fight with you on that one, but
right. And I
That's my
understand. It is hard to know. I mean, right now we actually are having a testing shortage of supplies. So I
Right.
do know we're already overwhelmed with the system. The state of Missouri is going to continue to push money toward the control of this virus. And so again, we're seeing our economy just really decrease
Yeah,
at this point.
I'm seeing hospitals furlough people, so I have a hard time believing that. I mean, but let me move on from that.
Okay.
Now we know that, and I know you've got a tough position here, right? No, you got a tough position here. We know that underlying health issues is a major contributor to the COVID deaths. We know that. In the midst of all this stuff we're doing, are we doing things to address those issues?
As far as underlying health conditions, we do recommend that those individuals try to stay home as much as possible. I don't have any statistics on how many COVID deaths actually have occurred due to underlying health conditions being an underlying factor as well. I can tell you the one case that we've had in Christian County, that individual did not have any underlying health conditions and she still passed away.
Yeah, and the CDC not too long ago said 76.4%.
Yeah, and I haven't seen those. Again, I just know for our own county, that's not the case here. So,
Massive.
yeah.
No, I agree with you. I know you've got so much. I think this is my final question. Let me make sure. I might have two more. Let me make sure.
That's
I'm
fine.
sorry. Okay, I do have this one. Two more. Because you've answered some of them, and I appreciate that. If we go forward with a mask ordinance, okay, a lot of the ordinances that we've seen from other parts of the country, including here locally, I believe in Springfield even, they exclude non-public businesses. And my question is, and I mean, I think I know the answer here, but I want you to tell me, is if I've got, now this is not specific to Ozark per se, but I know we're not exactly typical to some of this, but say for instance, we had a call center in Ozark and we had employees sitting side by side 8-9 hours a day, not socially distanced, not required to wear a mask because our ordinance said they didn't have to because they weren't public. That's not a lower risk, right? I mean,
No, there's a high potential that somebody in that group would have COVID-19, whether they have symptoms or not. So,
okay, that's what I think too, because I think if we do something like that.
And I don't think that they're excluding that verbiage in the ordinance on purpose. I think it's maybe an assumption that people know that if you're not socially distancing, whether it's indoor or outdoor, that you really should be wearing a mask or doing something different. You're trying to socially distance. I know at our health department, since I've been the administrator, we've wore masks because we can't socially distance of 6 foot in our small building.
And I don't argue with you on what you just said, but if I use that same argument, I'd say that people ought to know if they can't social distance, they ought to wear a mask, and we don't need to make them. But,
yeah.
but no, I'm with you. I'm with you on that. Okay.
Right.
Here's the last one, and I don't know. This might be more for the board than you. So I apologize, and I don't want to put you on the spot here. I'm using a couple of data points here. The July 14th, 2020 CDC press release that called for Americans to wear masks. It was a JAMA editorial review. It said that in April, they analyzed a survey and found that 62% of people said they would follow and wear masks based upon the recommendations. And then a month later, they repeated the same survey, and that number had gone to 76%. One of my concerns isn't, as Mr. Schaefer said, wearing mask or not wearing mask. It's the mandate versus non-mandate. But one of my concerns is incrementally, in all seriousness, and incrementally in Ozark, Missouri, if we force the issue, what are we going to get over the voluntary mask wearing already? And incrementally, is that material to doing anything to move the needle as far as, I don't care about cases personally. I care about hospitalizations and mortality personally. That's me personally, versus number of cases. But does it do anything to move that needle?
Yeah, if it helps. I mean, honestly, I think it's too early to know anything with Springfield Green County at this point, because they just implemented theirs about a couple of weeks ago. And so they wouldn't have any statistics on that. But as we saw with the wearing of face mask on Great Clips situation, obviously the study that came out with that, I mean, that does show that face masks work. So I do think we still have to keep pushing for that. However, I know there is a strong opinion for or against face masks. I did go to Walmart over the weekend, and Walmart is now mandating that employees as well as patrons wear their face masks. When I was there Saturday, their parking lot was full, and I didn't see anybody in there that didn't have one on. So, you know, I'm not saying that there wasn't one or two walking around that I didn't see, because it's very possible that that's happening as well. I think that, you know, people are going to step up to the plate eventually, because they're going to see the light at the end of the tunnel here. Our economy is really going to pot, should I say? Yeah. And we've got to do something. So whenever we have cases, if we're going to bring these individuals in here without a face mask, and then the county surroundings have one, what's going to happen here? Again, we're going to increase our cases, and then our people are going to go somewhere else and shop. So,
well, that's where I take the stance personally that we need to be working with our business owners, because it really, to me, it's an economic issue.
Yeah, and I didn't see, like I said, even at Walmart with their parking lot being full, it didn't stop people from going there to shop. And you know, it is a small sacrifice. You have to put it on. You don't have to have it on in the parking lot, but when you get in there, you do. But people come right out of the store and they take it right back off. So to me, that's a simple sacrifice that's just minor compared to closing down businesses again if we have to go that route. And the reason I keep referring back to closing down businesses, whenever you have somebody that has COVID-19 in a business, we call those individuals, and then that individual has to be put on isolation for 14 days. So everybody in that business that's had at least a 6-foot exposure, a cumulative 15-minute exposure with that individual, is going to be asked to quarantine. And so that quarantine period depends on several things. If it's a household contact, that household contact's quarantine doesn't start until after the actual case is released from isolation. So after their 14 days of isolation, that's when the household contact starts. So you've already got potentially 2 weeks that individual can't work and should not be going out into the community, because they have a potential of getting the virus during the time that person's infectious. So then we have to have them go at least another 2 weeks after that to see if they have symptoms, because we don't want to put those people back out to work or around other individuals either, because if they develop symptoms, then we have another potential group of cases off of that individual. So we do use CDC guidelines in order to educate the individuals on that. But I know of a couple of businesses already in Ozark that have had to close due to that. So they've, so it is going to happen. And so I know they're saying, okay, well, let's just let these people come in and we'll serve them and it's all great. But you know what, when they bring more COVID in there, there's a higher risk that these individuals are going to get COVID too. So their businesses may end up having to close. Maybe not only for 2 weeks, but it may be 4 weeks. I don't know. It's just going to depend on how many cases do we have and how long do we have to keep quarantining people or isolating them. So there's a lot more to it than just, okay, it's not like the flu. You get over the flu, you don't have a fever for 24 hours and you go back to work. That's not how this works. And unfortunately, it's because we don't have a treatment for this and we don't have a vaccine. And even when we get a vaccine, the vaccine's not going to be 100%. So if we're waiting for the vaccine to help control the situation, it's not going to be anytime soon. And another problem that we're seeing is with the immunity. So when somebody gets COVID-19, we really don't even know how long they have immunity. It may last 2 weeks, it may last a month, it may be lifetime, but there hasn't been any studies done enough to support that. So
I personally, and I agree with you on that one, I personally have not been tested, but me and the family and my wife and all are pretty much convinced. I've probably had it twice. The second time was nothing like the first time, but so yeah, so that was December, late December, January, actually before we knew what in the world was going on. But if we look back at it, I had every symptom that we now say is it.
We're seeing that. And I think the data right now is suggesting that if you had maybe a mild case to begin with, then maybe you could get it again. But again, I mean, there really hasn't been any studies, so we don't know.
Yeah.
So we don't know, are we really making any ground by these people that really have had the disease if they're going to get it again? And then again, we don't have a vaccine that's going to be 100%.
And part of the problem, and I'll wrap up with this and I'll be silent. Part of the problem with all this is exactly what you just said. I mean, this is so new and the data is moving so fast. We're learning things, and as we learn things, we have to adapt and change to it. You know, early on, we thought masks weren't real effective. We've learned now that they're probably, the last study I saw probably reduces 15, 16, 17, 18%, something like that, you know. But maybe we'll have another study that shows it's doing more than that even. It's just moving so fast that we don't know. The issues for me, my summary issues would be, I want, if we're going to do a mask ordinance, I want somebody other than a politician telling me when it's okay to quit.
Yeah. And you know, that really would be above my knowledge as well.
Yeah.
We leave that to Centers for Disease Control and Prevention, World Health Organization, and the Department of Health. And so whenever they put out information, you know, that's what we use as our guidelines. So again, we're trying to be consistent with the rest of the state as well. We're trying to follow the guidelines, because if we do this, since this is a global pandemic, so we have to do this, you know, not just kind of hit and miss everywhere, because we're not going to get anywhere. So it's a hard position for everybody to be in. I don't like wearing my mask either. And, you know, I have to do it. I've been a nurse for 25 years, and I do know a lot of people don't want to wear it. They say that it's restricting their breathing. I haven't seen any deaths from anyone wearing a mask. And, you know, and I'm not saying that that's not possible, because it probably could be, but that's not something, you're more likely to get COVID-19 than you are to die from wearing a mask. Right. And it's not like we're making these people wear these masks for 24 hours a day, 7 days a week. It's less restrictive than closing down the businesses again. Honestly, I'd like to be able to go back over to Walmart after 8:30 at night, because sometimes I don't get off work till 8:30 at night. But because of COVID-19, I can't do that, because now Walmart closes at 8:30. So, you know, in all reality, if we can get the numbers down, we wear a mask for just a few hours or minutes just to go in and do our business and then get back out, it's going to help us. Those businesses are going to be able to open back up more hours, and they're going to get more business. But again, I'm concerned because now we're sandwiched in between Taney and Greene County that have ordinances in place, or going to have soon. And so we're going to get their COVID-19 positive patients coming here, but our individuals that want to be protected are not going to give our business to our county if we're not going to protect them. So, and I don't blame them.
Yeah. I do appreciate you. Thank you so much.
You're welcome.
Yeah, Jay, or RJ, you're next, but I want to ask you guys a favor. I don't know how well I can be heard with the mask on, and that's why I left mine off. And of course, everybody out in the public has seen that I don't have it on. So I want to wear it, but I want you all to tell me if you can hear me, because the technology in here is somewhat limited. Is there any problem? Okay, all right, good, then I will leave it on. Okay, RJ?
You know, the Ted kind of hit a lot of points that a lot of things I would want to ask too, but the one thing that I would be curious about is, you know, the mask would be to stop spreading, community spread is the one thing that we'd be trying to accomplish with that, is stopping community spread. So I think an important question is, out of the 248 cases that we've had so far, is are we seeing that being mainly community spread, or is it because I remember a while back we didn't have a lot of community spread. So considering the masks aren't going to stop you from spreading it to people that live with you and your, you know, friends in small settings, it's going to stop you from spreading it to strangers. And I'm not trying to say it either way. I'm just curious what we know as we track that. Are we seeing that most of these cases are from people where they don't know where it's coming from, or they don't know where they picked it up because they picked it up from a stranger passing by at a random store, or can we track that back and know, like, oh, well, I got it from this person and I got it from that person? Because I think being able to see the cases that we have and the amount of people that we have in our county, I think that's a really something we should be considering when what we're going to pass is really only going to affect community spread.
Yeah, so I can somewhat answer your question here, because we're still following up on 52 of our cases that we just recently got over the past 2 days. So while we're getting that information, we don't have it exactly in our spreadsheet, but I can tell you what we have right now is 196 cases logged. Of the 196 cases, 94 of those are community spread. So those individuals had no idea where they got it. In fact, the lady that passed away of COVID-19 in our county, hers was community spread. She had no idea where she got it from. Her husband had no idea where it came from as well. So I do have to say, you know, that was very unfortunate for them. So as far as known contacts to positive cases, we've got 102 of those. Again, keep in mind that there's 52 that I don't have that data on just yet, but right now it's running pretty much half and half. So we do know there are a lot of asymptomatic people out in the community that are spreading this. One statistic that I remember seeing through the Department of Health testing said 51.8% of the testing that the Department of Health alone has done has shown that 51.8% of those individuals are asymptomatic. So they don't even know that they have it and they're out there spreading it. So, you know, I'm tickled to see that some of the schools are starting to be like Walmart and take it upon themselves to make this mandated face mask ordinance a priority for them as well, so that they can keep their own businesses open. Because what we're concerned with the schools starting now, I know Governor Parsons had said something about the children are gonna get over it, they're gonna be fine. Well, not all children will be, no, because there are children out there with disabilities that are vulnerable populations. So those are the individuals that we need to protect too, and not only the elderly or the adults that have some sort of chronic diseases. But, you know, a lot of children these days are being raised by their grandparents. So that's really who we're trying to protect, not necessarily the school kids 100%, because yeah, most of them are going to be healthy, but you have teachers that have health conditions too that make them more vulnerable as well. So, you know, we want to protect everybody overall, but most likely we will see the younger generation that have a healthier immune system fare through this better than the older populations or those that have underlying health problems. So again, I'm glad to see some of the schools are stepping up to make that a mandated ordinance at their school as well, because again, we're protecting our community in general, just because they're going home to their families and their grandparents that are raising them too. So, you know, if something happens to those grandparents, who are going to raise those children? So we've just got to kind of think about the whole picture here and what's going on. So we're not really wearing the mask to, per se, protect ourselves 100%. We're actually doing it to protect our neighbors, our community, our families, others around us. So it's not all about us, it's about everyone else.
I guess my other question would be, and you may have, I don't think you quite touched on it, but out of the 248 that we did find, do we know how many of them were asymptomatic, or were those all actual cases where they were exposing, like they were experiencing sicknesses and stuff?
Yeah, we do ask them whenever we interview them. I don't know, I don't have that information with me, but I think I could get those numbers to you.
That's all the questions I had.
Okay, thank you.
Thank you.
Adrian?
Yes.
Yeah.
Thank you, Dr. Peak. Thank you for meeting with us tonight. I got a couple questions I hope you can help me with. Infection rate among kids. Now we know they fare better if they get COVID. Do they actually have a lower infection rate, or are they still infected at the same rate?
I'm not sure I'm going to answer that 100% correctly, but I don't know that there's any evidence out there that says that they're more infectious or less infectious than anyone else. So again, I think it kind of depends too on a lot of factors, even of the immune system or how well their body fared whenever they got it. So was it a mild case or not? They might not be as likely to spread it if it was a mild case. So again, I don't know that I can truly answer that question for you because I don't know. I'm not a physician. I haven't really.
Okay. Have we identified any group, any blood type, anybody? Is there anybody out there that is immune to infection?
Immune to infection?
Yes.
Of COVID-19 or just in general? Because I don't know anybody that doesn't get an infection of some sort.
Of COVID.
If that's what you're asking me.
Of COVID.
Not that I'm aware of. I said I've seen cases all the way down to 6 months old. I do know that there's been some individuals too, not necessarily in Christian County, but reading some reports as far as even pregnant individuals that have had stillborn babies that have tested positive for COVID-19. So I think it's just all over the board. There's not any age group or demographic that makes anybody less vulnerable than anyone else at this point in time. So everybody has an equal opportunity to get it if that's what you're asking.
I didn't know if kids had a little better chance or not, but yes, that's kind of where I was asking.
And you know, I do want to throw out there too, since summer school had started and since we've been seeing a lot of sporting activities going on, group activities, camps, we're seeing a lot more youth or younger generations having the infection rates at this point in time. So that's why we're probably not seeing a whole lot of deaths. And I don't know why it's, you know, I don't know why we don't see a whole lot of cases. I mean, in the elderly population right at this point. I mean, we have them all across the board, should I say. But right now, the majority that what we're seeing because of all of these activities opening up, that's where we're seeing the younger generation start to come into play here. So that's why we're concerned when school's going to start in about 3 weeks. What's this going to do to our numbers? I don't know. But
I know a while back I had read a study that had shown that even people that had mild symptoms had internal lung and heart damage, and it wasn't known at the time whether that would kind of heal itself over time or if this was going to kind of be a you know, something they had to live with. Do we know any more about that now?
I really don't. Again, that's for CDC and World Health Organization to track those kind of things off of the data that they're getting or collecting at this point in time. I have heard that there could be some underlying conditions that would maybe be resolved or maybe not. I don't know. So I honestly cannot answer that one.
All right, I have one more question. This one kind of concerns me a little bit. We know what COVID can do when it hits a smoker, a cigarette smoker. Do we have any idea what happens when COVID hits an otherwise healthy 18, 20, 22-year-old that's been vaping for the last 2 or 3 years?
We have actually seen COVID spread through people sharing vaping. I can tell you that. But as far as I know, I mean, I don't know of any deaths because of that. I would think anything, you know, that's respiratory related, if you already have contributing factors such as smoking, I think that would potentially make things worse.
Okay. Thank you. And again, I appreciate you doing this tonight.
Yeah, you're welcome.
All right, anybody else have any questions? We can, yes, Jason, I saw your hand first.
Dr. Peak, thank you for coming to speak with us tonight. My understanding, there's 3 things the public can do. They can wear masks, they can wash their hands, they can keep 6 feet apart. Is that it, or is there something else we're supposed to be doing?
Well, stay home if you're ill.
Sure.
Yeah, clean frequently, touch surfaces often. Those are things that we want to do. Yeah, I mean, if you wear your
Back
mask.
to the
everywhere,
community
that's
spread
cool.
issue, the community spread being out in public, we're talking about those 3 main things. Is that about right?
Yeah, at this point in time, I mean, obviously the stay-at-home order worked, so that was going along with this, socially distancing at that point. We didn't wear masks then, or most people didn't. Some did, but those masks were hard to find back then. But yeah, definitely.
But for today's open society, where we don't have a stay-at-home order, if the people are out in public, we're asking them to wear a mask, wash their hands, and stay 6 feet apart, right?
Correct.
All right. Of those 3, which is the most effective?
Well, my personal opinion would be socially distancing, but that's not possible with a population of 89,000 people, and when you're working out in public or you're shopping in public. So then you can't, that alone won't control it. So the more preventive measures that you have in place at one time, again, it goes back to that Swiss cheese model where the more slices of cheese that you have, there's no holes. So that's really where this goes to with this.
But the social distancing, in your opinion, would be the number 1 factor to help community spread?
In my opinion, yes, because we want people to stay away from each other with 6 foot distance, because with aerosolization, if somebody coughs, sneezes, or what have you, that's how that's spread, and then they inhale that. So that would definitely prevent it. But if you can't do that, if you have a mask over your face, then if you cough or sneeze, it's inside that, so it can't get outside that mask, and then it can't go over and get inside another one if somebody has it on.
Between hand washing and the mask, which one's more effective?
In my opinion, it would be the face mask.
Okay. Thank you, ma'am.
Mhm.
Yes, Dr. Peak, you had mentioned that you are not a medical doctor. Where do you get your doctorate from?
I have my doctorate in nursing practice.
Okay, thank you.
Uh-huh.
I wonder if you could maybe help me understand the role of the health department under the governor's emergency order. I guess I'll start with, I was just checking the governor's order. The governor declared a state of emergency and extended his order to August 28. And he activated the emergency response plan. And I did take it's been a while since I looked at that statute. What is the role of your organization under that emergency response plan?
We are the ones that are doing the disease investigations, which is not unusual for a health department. So we have a list of, there's over 100 communicable diseases on that list that under the Department of Health that we're responsible for investigating over, any given time. So that ranges from things like salmonella. We have STDs out there that we have to investigate as well. Any of the tick-borne illnesses, there's all kinds of things on that list, including influenza. So the health department's role in the COVID-19 is to help slow the spread, or to help with preventive measures in order to stop the virus totally. So our role is to provide vaccines whenever that becomes available. Our role is to do these disease investigations to try to see if we can stop the spread at any given point. So what we do is we contact the individuals once we know that they're positive, and then we get a list of their contacts to try to figure out who they were in close contact with. So rather than just putting a blank statement out that, hey, everybody's been exposed, we try to do it in a discreet way that we get names and numbers of individuals that we call. And so sometimes we have cases that have maybe 2 contacts because they are not real social and they haven't been anywhere. Others, we have maybe 50 or 60 people that we have to call. So that's where our role of needing the contact tracers come in, because we have to get hold of all of these individuals, educate them on what their exposure has been, give them information on ways that they can prevent becoming ill, and then monitor them as well. So we make frequent calls to those individuals too, or have them call us back to let us know if they're having symptoms. So at that given time, if somebody else develops symptoms, then they're referred for testing. If they test positive as well, then we have to contact them and get their contact list. And so the changes goes on and on and on. You know, there's other people that like to go out and eat at multiple places. So we have to get in contact with those individuals too. Sometimes the businesses, we contact them and let them know that there's been exposures there too. Or we may contact schools and let them know, like we're working on a situation now with some kids being at a prom just recently. So lots of work going into that as well. So educating the parents, educating the students, educating the community. So that's really what our role at public health is, hoping for a vaccine so that we can vaccinate these individuals and hope that the vaccine is good and it's given us enough immunity to stop this virus.
So under the governor's emergency order, your organization is on the cutting edge of addressing the pandemic in our county, it sounds like.
Yes. Yeah, we're only responsible for Christian County, but we work very close with the other counties surrounding us. So specifically with COVID-19, we're on the phone about every hour with one of the counties surrounding us or even another state. So it doesn't just stop at Christian County. We work with, you know, just about anyone. We've contacted airlines before, businesses, restaurants, just you name it, anybody we can get hold of to educate them. So the role of public health is prevention, promotion, and protection. So that's what we do with about anything that we do at the health department.
And then are you here then under your capacity, or in that capacity, advising our city government to pass the mandate? I mean, this is an official position.
Yes, as an administrator, and I have been in contact with our board of trustees. We do have an official statement from the health department that says we do fully support a mandated face mask ordinance in order to help us control this. Again, we're public health and that's what we do. So if we can prevent one person from being infected, if we can prevent one death, that's what we're here for.
So then your advice comes under the mandate that was provided by the governor in his emergency order, which basically allowed your organization and other county public health organizations to address this pandemic.
Yeah, that's correct. We work under the direction of the Department of Health and Senior Services in conjunction with Centers for Disease Control guidelines as well.
Okay. So I'm going to switch my questions to Mass. I noticed that I think is it Dr. Trotman, is that how I say his name, from Cox Medical Systems?
He's an infectious disease physician in Springfield.
I was reading from the Cox website or that he had said that as far as wearing masks, it was understood that if you had compliance, wearing masks would directly impact the spread of the disease. Is that something you agree with?
I do agree with that. Yeah, and again, it has to be consistent, and it has to be an accurate. You have to wear it accurately, meaning over your face, your nose, and your mouth.
And I think also Dr. Trotman stated that as to the negatives of wearing a mask, he had stated that medical personnel wear masks all the time, like you did. I think he also said that there are no cases in which wearing a mask caused anybody to be hospitalized or harmed. Does that sound like something that you would agree with too?
I would definitely agree with that. Again, I've been a nurse for 25 years. I've worn many masks for 8 and 10-hour shifts. I've seen doctors do that. They do that in surgeries all the time. And again, that's not a I've never seen a death certificate come through, even the years that I've worked at the health department, because somebody died because they wore a face mask.
So the idea that there's carbon dioxide poisoning or some other complication from wearing masks is a myth.
I would say so. I've never seen any evidence-based information that's stated that. If that was the case, we would have multiple doctors and nurses or any other individual that's required to wear a mask due to their immune system while out in the public. We would have a lot more, we'd have deaths reported. I mean, that would be very well known, I'm quite certain.
I also happen to view the Cox Hospital Administrator, Steve Edwards' statement on the issue. And he had said, just like you did, that there were limited supplies of for medical responses to serious cases of COVID. And I can't pronounce the name of one of the medication, Respivir, something, begins with an R.
Respiravir, I think is how it's pronounced.
How is it?
I think it's Respiravir. I may be saying that wrong as well because I don't give it. So again, it's kind of an area out of my expertise, but.
He said that there were enough doses for 10 patients. Do you know if that's changed? I think he said that a couple weeks ago.
My understanding is it's not changed. And again, even if they have that medication, it's not 100% as well.
So right now, as we sit here now regionally, we're kind of on the bubble. If we start seeing rising numbers and those cases of serious cases start to rise, at 10, we've reached our capacity in the region, the entire region. Am I understanding that right?
You're correct. Yeah. And if you look at, like I said, the statistics that we have just over the past, past month, I'll say 192 positive cases just in our county. I know Greene County's already got over 1,000 cases total since this all began. So with us only being 6 miles or so from them, I mean, that's very scary to me. So if those numbers continue to rise, yeah, it's not going to take very long to have those 10 doses gone. And again, it might not even be effective anyway. So the best case scenario at this point, we have to protect ourselves against this virus. So not get exposed to it, however that may be. So the best case scenario at this point would be to wear a face mask, which is the least restrictive preventive measure that we could potentially do at this point.
I had begun the discussion, I think, before you were able to log in, and I certainly sympathize with having trouble to log in on Zoom. But I had mentioned that there was the Ozark School District had announced to parents that there was exposure at a prom where masks were worn. And I'd made the statement that it seemed to me that we needed to make a decision now, not kick the can down the road. What are your thoughts on that?
Okay, if you will clarify what you're wanting my thoughts on.
Yeah, is it important that we act now, or do we have time to delay a decision on something like a mask mandate?
I don't see delaying it at this point is going to be very effective. Again, we did our press conference about 2 weeks ago. We had requested that the community step up and wear their face mask, and that's not happening because our cases have not went down. They have only went up since that time. So again, even if a mandated face mask order would help us get to 90% of the people wearing a mask, that's better than what we're doing right now, which is potentially 50 or 60% maybe. So anything we can do at this point is going to help. It's going to help to keep the resources that we have now in case we do have more cases later as this virus potentially changes. We don't want to deplete our resources. We don't want to continue to destroy our economy, which is happening at this point in time. The state of Missouri is going to continue to put money toward trying to find a way to stop the spread of this virus, which that also means that the state programs They're going to start having people lose their jobs because of that, because the state doesn't have that kind of money to continue this fight. But we have to do it because, again, if we can save one life, then that's what we're here to do.
I wanted to ask you about compliance. I guess I wanted to ask you about your point about Walmart and the fact that people do comply with Walmart's mandate. How does that relate to our ordinance? What are you trying to tell us?
Well, in my opinion, I know, you're going to have a certain percentage of people out there already that they're going to protest and be mad no matter what you do, whether it's COVID-19 or something else. We already know that. We see that all the time in the news. But, after a while, people get used to things, just like they got used to the stay-at-home order. We learn to adapt. So I think that's what we're going to have to do at this point in time. We have to remember that this isn't going to be for the rest of our life. This is just going to be for a while. We don't know how long that while is, though. But I just think that we all have to step up to the plate. Some of us maybe need a little bit more push than others, just so that we all get on the same page.
Well, I wondered if you were making the point that because I was at Walmart before it was required, and I saw sometimes maybe 60% of the people wearing masks and sometimes 60% of the people not wearing masks. That's kind of what I observed. But it went, when Walmart made the mandate, it went to close to 100% is what you saw.
I did, yeah. And I think, if we stick together with this and we jump on board with Taney County and we jump on board with Greene County, these individuals are still going to be out shopping somewhere. You know what? But let's keep them in our own community, but let's keep them safe. So it's not going to decrease any income. Honestly, like I said, in the end, if we don't do this, we're just hurting ourselves because we're bringing more of this virus into our own communities.
Okay,
But
so
yeah,
I guess
I think people are, they're going to get used to it. They're going to see the importance of it. And once they see the numbers come down, they're going to have hope that we're going to get a move on a little bit quicker than what we are now, because we're not getting anywhere doing nothing.
And I guess the other point that I heard you make is you see the mask as a tool to keep the economy going, and the risk of not wearing the mask or requiring people to wear the mask is that our economy could suffer as a result.
Exactly.
Okay, that's my questions.
Thank you.
Ted? Yeah, go ahead.
Just a couple of points and all, and again, please, Dr. Peak, don't hear this as criticism, but if we've got roughly a 14-day incubation period before test positive generally, our press conference 2 weeks ago, we don't know if it's working yet or not. If I'm correct on the 14-day thing, because we're just now at that point. So
I can tell you, I haven't seen any more people other than in Walmart. No other people out in the community in general, but at the places where they are mandated, I am seeing more people wear those. I haven't been to Aldi yet, but I know even in my own office, we are required to wear a face mask during our entire work shift. I did have some pushback at first, but our staff finally got used to it. And, now we feel kind of strange whenever we go outside, we don't have our mask on because
right.
We just got so used to wearing it.
Well, again, it goes back to me. It goes back to one of my fundamental things is that I think we should focus on our business owners, and I think we should focus on the education. It's just a question of whether it's mandated or not at the governmental level, especially if we can't tell people how long we have to do this.
I think you're going to see a lot more businesses go to that as well. I would hope you would. Like I said, the schools, I know most of them are starting to get on board because they're going to see that they can't function as a school without having at least some sort of preventive measure in place.
Right, but I'm sorry, I didn't mean to interrupt you, but shouldn't our businesses see that too, though? That's using that same logic. I mean, that's my point. Our businesses ought to get this.
They
And
should,
it's
and I
not-
think eventually they will. And I want to say this, I get a lot of emails from individuals because we also do food inspections out at within the county and city. And so people send me emails all day long and say, hey, I was just at Brahms and they didn't have on their face mask. And so I have to explain to them that I have no control over any ordinance in the city or the county. I can only make recommendations, and I'm 100% in support of a mandated face mask ordinance. So I asked them, you know, to, if they're not comfortable going there, then don't, you know, find somewhere else to go that's going to protect you and that's going to protect their employees. I get emails all the time from school teachers too that are concerned because they don't want to have to go back to school and get exposed. And even though they might wear their mask, others aren't. So again, you don't have that protection because you don't have the protection you need because you've only got one layer there. But then if you have the mandated face mask order, again, that you're not wearing 24/7, but just in certain circumstances when you can't socially distance, then that adds that extra preventive layer too.
Right. But now the schools can decide for themselves if they want to mandate it.
They
That
can.
is 100% their responsibility,
Yes,
and they can do that. I just want to make that's clear. They don't
Yeah.
have to wait on us.
they don't. And that's how Walmart is as well. And Aldi, I know like several businesses are trying to go to that because again, they see the writing on the wall. I don't really know what this CARES Act funding is. There's I don't know what, I'm not even thinking I'm saying this right, but
The
There's-
second one or the first one?
well, there's something out there that has to do with employers having to pay employees.
2 week sick leave. Yeah.
Yeah, so it has to do with the sick leave. So I think
Right.
what they're seeing too, if that's a mandate for employees or employers, should I say, that's going to cost them a lot of money because if you have to pay someone to be off for 14 days or longer, because some of those, one of those mandates that I saw on that, the larger businesses are being impacted by that. So they either have to work with less staff or they're going to have to bring more people in. Plus they're having to pay their staff to be off on top of that. So that's costing them a lot of money.
Well, yeah, in Ozark, the school would be the only one that would qualify for that because everybody else is smaller and the government is reimbursing them for the sick leave. So
Walmart, did you know how that is? It Walmart?
Walmart would not. They're too big. They're too big. And you're right. I'm sorry. Walmart and the schools. I'm sorry. Thank you. Thank you for correcting that. Let me throw a hypothetical again, because I'm just stuck on this thing. I do not trust government anymore. And that includes me. Okay. I mean, I'm talking about myself because what we said, and we kept moving the goalpost without any identifiable, from my perspective, any identifiable objectives. We just kept moving it because everybody else was moving it. And I don't want us to get back into that same thing. So if we forced a mandate and our numbers did not go down, could we stop it? Because it ain't working either. Is that a fair question to ask?
I think you'll see the numbers come down, honestly, but I have, no 100% guarantee because again, we can't.
Okay, but then again, that's where I go back to. I want somebody to tell me, and I'm not putting that on you.
Right.
I want somebody to tell me what that number has to come down to so we can stop.
Yeah.
Because whether we like it or not, we've got 50% roughly, actually a little bit more, but let's just call it 50% of the population is adamantly against it and adamantly for it.
Mm-hmm.
And we're in the middle.
Yeah.
And that's fine. That's what we're here for. It's part of what our job is. But we've got to figure out, we can't do it because Taney County's doing it. I find that not acceptable. We can't do it because Green County's doing it. I find that not acceptable.
Right.
Why does Ozark need to do it? What are we trying to achieve objectively? And when we achieve it, how will we know we achieved it so we can stop? And until I get those data points, I'm not satisfied because of the example that we've had across the nation of the goalposts continuing to move, which does nothing but continue fear.
Yeah. And I think a lot of that has to do with this being brand new. So we're learning.
It is. And that's fair. That's fair.
Yeah. So it's not anybody's fault at this point because
no,
we're
no.
learning new things. So things have changed. I have to say that it's been very discouraging for the health department as well to have to deal with all of these changes.
Right, but somebody ought to be able to tell me when Cox and when Mercy is overwhelmed.
Yeah.
They
and
ought to be able to objectively tell me this is the percentage based upon our current hospitalization rate, mortality rate. This is the point when the numbers of tests will overwhelm us. Somebody mathematically ought to be able to tell me that.
Yeah, and I agree. I
And
think
all I hear is just do it, just do it, just do it, just do it. And that's what I'm saying. I'm not fighting it. Understand, we wear our mask.
yeah.
This family wears our mask. So I'm not anti-mask. I am a lot like, I hate to say it, Mr. Schaefer at this point, where I'm just saying, I don't trust anymore. And I need to be able to trust. For this to effectively work, our people, the 50% of the people who are adamantly against this, 53%, whatever the number is, they have to be able to trust us.
Yeah.
And they have to be able to comply. And if I'm not convinced that they will or they will trust us, then I don't know what incremental benefit I'm doing. And again, I'm beating a dead horse here. I don't mean to, so I
I
apologize.
know our kind of, but you have the right to. Karen, let me make one quick comment, and then Mr. Galloway's got his hand up, but I'm gonna be really fast. Karen, you don't have the advantage of knowing all six of us and knowing our perspective. That's kind of the position that we're in as a board of aldermen trying to make a decision for the community. Ted is a CPA. He makes his living with numbers. He lives and dies by numbers. He's laughing, but it's true. He makes objective decisions every day according to what the numbers say. That's what he does, and that's the way he's wired. So just understand that not everybody is that way, but it's okay for him to be that way.
Thank you.
So, okay, Mr. Galloway.
Well, Dr. Peak, I guess you don't plan to go anywhere, right? As if we enact this ordinance, I mean, you're going to tell us when you think that the trend is that we can release ourselves from having to wear paper on our face.
Exactly. You know, I'm not enjoying wearing my mask either, but I feel like it's my responsibility as a community member. Unfortunately, not everybody feels that way. And I just want to point out that our prison systems would not be overflowing if everybody did the right thing. You know, so honestly, we can't always make them do that. But you know what, if we do have somewhat of a ordinance in place, I think more people will be more willing to comply because they know that's the right thing to do at that point, because there's something there that's pushing them a little bit more than just them making their own decisions at this point. I think they really need to think about the long-term effects of, again, this is going to do to our economy, what it's already done to our economy. So we've got to find something, because right now we have nothing. And if we can at least try at this point, and I know I would like to put a number to it as well, but I can't do that. I don't know what the hospitals are going through because that's really not my job. But I would hope that Dr. Trotman would be able to work through that with you as well, because he's on that side. He knows how we stand as far as healthcare, being able to take on a lot of these cases. But my concern is we don't want to get to a point to where we are already overwhelmed our healthcare system, because at that point we will see a lot more death, because we're not going to have beds for these people. We're not going to have ventilators, and we're going to be fighting the rest of the country to try to get those resources as well, because we're seeing lots of cases come back all around the states, globally, actually. So it's only going to get worse resource-wise. Again, over the past 2 weeks, I'm already hearing that we have a shortage of testing again. So I don't know. I mean, there's no 100% answer for what we should or should not do, but from a health department perspective, we do want to prevent any illness and prevent any death that we can. Even if it's one, it's worth it to us.
One technical question. I was reading that the cloth masks that have the little vent, built into it with the filter, that those were not effective in what they're designed to do, which is to prevent droplets from being spread. Is that true? Would your recommendation be that that kind of mask not qualify?
I honestly could not answer that with confidence because I have not done any research on those type of things. I would see it as being as you potentially being correct in that, just because the droplets can come outside of that with those vents there. The same thing with face mask or a face shield that comes down. Is the people that say they can't wear a face mask, the next best thing for them would be a face shield. So a face shield or the mask with a vent would be better than nothing, but that probably isn't our best option.
Okay, thank you.
Mr. Flores.
I'm sorry.
Well, it's hi Karen, it's RJ Flores, but what I would be asking about here is do we have out of the 248 cases earlier when we're talking, it's like we don't know how many of those are asymptomatic. Do we have any way of tracking different things like where these people are at? Because one thing that I would be concerned with, especially doing a mask ordinance, mandated right here in Ozark when no one around us is doing it. How much is that going to help us or not help us? And how many of those, cases are here in Ozark? Is that any of that data available to us? Are we tracking these, or do we do interview these people, right? And find out if we find out whether it's community spread or these kind of things. I mean, is there not an Excel spreadsheet or anything that kind of we can look at and tell us these simple facts?
We're not releasing a lot of information because of the protection of their confidentiality. We have some cities that maybe only have one case, and those people would be very easily to identify. So that's why we're trying to protect that information. So we will not be releasing information as to who's in which city, how many, because we don't want to put targets on those individuals. So we are required at this point to release addresses to the Christian County Ambulance District, which again, I don't necessarily agree with because they should be taking their precautions with every patient, especially since 51.8% of the population do not have any symptoms. So they should be out there wearing their face mask anyway. So I'm in communication with Dr. Randall Williams over that one because I just don't agree with even releasing those because there's a potential of that information confidentiality being breached because of that. And so with any disease investigation, we don't want anyone to be identified, just as if it were you wouldn't want your information out there either, or people come into your home, spray painting your house or toilet paper in your yard or those kind of things. So we are bound by law to protect as much information as we can. So that's why we're not releasing that information at this point in time.
So not even the asymptomatic part, even that's confidential?
No, that is not. We do track that. We would have to go back and put that on a spreadsheet. What we were doing for a while is we were reporting the low incidence exposures, such as say Lambert's and Walmart, those kind of things. We had started putting that information out in press releases, but at this point in time, our health department's so overwhelmed with cases, we're not able to do that any longer. So we would have to pull those cases and potentially put that into an Excel spreadsheet. So we'd have to go through 248, which at this point in time is not going to be feasible for us because we have 2 nurses for 89,000 people in our population. And so it sounds kind of crazy at this point, but I'm in the process of hiring 23 people and I only have 15 people, including myself, employed at the health department. So if that tells you how overwhelmed our health department already is.
I can imagine.
Yeah, so I mean, we're doing the best that we can do, but again, we are tracking that information. I was trying to look here to see, I don't think our nurse has those numbers on here. It's just, she has community spread and known contact, but I think she could very easily go back and let me.
The reason why it's important to me is just because, when you have half your population that wants and half the population doesn't want it. It seems like when we take a county with 83,000 people and we look at the 248 cases and we want to mandate masks here in town, if we decide, like say that's what we're looking at, obviously, it feels like we're flying blind on that. So we don't really have, basic information that tells us what we'll be able to do. I'm not questioning whether masks are effective or not. That's not what I'm questioning. What I'm questioning is how effective is it for just Ozark to do it, not the county to do it, not Nixa to do it. And when we don't really know, how many people we have in our area, how many people are walking around asymptomatic, there's just a lot of different things. So, and whether we can even enforce it correctly.
Yeah.
So that's the reason why I figure that anything we can get that's information on any of those things, it's really going to help.
Well, as far as
one way or
asymptomatic,
the
I
other.
can tell you with the state testing alone, which is what a lot of ours come from, 51.8% of the population that are positive do not have any symptoms. So those individuals have done the testing that was free through the Department of Health, because they did the free testing site up at the Ozark Empire Fairground in the end of June. And so that's why they did that testing, to see how many people are asymptomatic that don't even know that they have it and are carrying it around. So that was a good way for us to know. Some individuals are being tested because they're having surgeries as well. And so they get tested 3 days before their surgery to see if they have COVID-19, because obviously they don't want to take that into the hospital and then get surgery on top of having a virus as well. So that's where some of those asymptomatic cases have been found as well. Right now we have a pretty good distribution over all of the cities in Christian County, and there are a good number of individuals in Ozark that are having this virus as well. So again, I can't provide you any numbers, but I can confirm for you that you do have cases in Ozark.
Okay, thank you.
Heather?
I think one thing that makes us a little bit different maybe than Nixa is our tourist population. We have people that are coming into Ozark on their way to Branson. Some are coming to this area from Florida and Texas and Arizona, and they're coming to our area. Particularly, they have picked Missouri because we have a low COVID-19 count next to what their state is. So we have a lot of tourists coming in, and because we're not requiring masks, a lot of them are not masked, which worries me. I had a couple today that said they came up from Florida because they were getting out of Florida before it closed down again, and they picked Missouri because we were low. I said, well, thank you. So just something to think about. We do have people coming to our area and we hope they're not bringing COVID-19 with them.
Well, they're coming from hot spots, and my guess is they probably are, and they may not even know it.
That's right.
The same thing too is what I just mentioned a couple of times. The individuals that don't want to wear their masks in Greene County are going to come right down here as well. So our numbers are going to increase potentially because of that. The same thing in Taney County. If they're that adamant that they don't want to wear a mask, they'll find other places to go. That same situation happened with the shutdowns too. I know people from Ozark, once it shut down, they were going to Ava to get their haircut because that's where they could go get their haircut instead of waiting until we open back up. So that's just how people work. And we know that's what's going to go on anyway.
Let me make a comment here. I'm not really saying that much, but I have spoken with the owners of a restaurant here in town. I don't want to name it, but it's a popular restaurant and people like to go there. And Pam and I went there Friday night to eat, and we wore our masks in and we wore our masks when we left. We were absolutely the minority. And I had people that were there, even a person that I had no idea who he was, came up to my table and said, "Are you the mayor of Ozark?" And I said, "Yes, I am." And he said, "Well, I just want to commend you for not making a mask ordinance mandated." He said, "We came down here from Springfield, and that's the reason we came, is because we didn't have to wear a mask." Now, you're not going to wear the mask when you eat. So what he was saying is, I just didn't want to wear it in, and I didn't want to wear it out. I didn't want to be told. At least that's the way I took it. So we're going to attract people that don't want to wear masks, and I don't know if they're infected or not. But you got this picture of people that could be asymptomatic, but they're not going to wear their mask because they don't have to. So you could be attracting those people. And on the other hand, this is this is a restaurant. It's different from Walmart. You know, most of the people in Walmart wear them. I was at Lowe's today. There were probably more than half the people that had them, but there were a lot of people that didn't. But the restaurant owners seem to think, or at least this one, that that's going to hurt their business, and even their servers did not have masks on, which I find quite interesting because they're really close to the food. So, you know, I don't know any more than you all do, but I just want to tell you that I pleaded with them. I said, I know masks will help. And of course, they're afraid that when so much business is coming their way because they don't have to wear their masks, they're afraid that it's going to affect their business. So that's
Well, they're
just another side of the story. And they're going to be, I'm sure, very vocal Monday night. So,
Yeah. They're exposing their employees and they're exposing their employees' families at this point as well. So again, we'll see more cases of it just because the people that don't want to wear them will come here. I can guarantee you they will. So I don't know, but there again, I mean, we will have people that live in Christian County that will go shop and eat in Springfield because they're thanking those individuals too for keeping them safe and their employees. So, you know, it is across the board. There's strong feelings both ways.
Ted, were you getting ready to say something?
Yeah, I mean, again, not trying to beat a dead horse and all this bit, but just bringing it down to the basics, using and not to get in a fight with Heather, Miss Alder, but at the end of the day, how's this going to be enforced? If we did it, how's it going to be enforced? It's going to be incumbent upon the business owners to enforce it. I mean, if we just boil it down to the basics, it's what's going to happen. And so again, I go back to, I would rather, if we were going to do it, I would rather we just say all business owners, you have to require masks if you can't socially distance, period. Public, private, everybody. Don't tell the people, I know it's a nuance, don't tell the people, but to say business owners, you've got to do it because this is where people are catching COVID. And put it, because it's really going to be incumbent upon the business owners to enforce it anyway. I mean, if
they need to set the example. They need to set the example.
They need to set the example. That's exactly right. And I mean, we're seeing, and now we are so blessed in this that we are not like this, but you know, you're seeing sheriffs in LA, you're seeing sheriffs in Indiana and all over the place coming point blank out and saying, we are not going to enforce it. Now we're blessed in our police department and Chief Arnold and everything else that our police department is top notch. But that's a symptom of some of this issue across the nation. And I know that's not just us specifically, but at the end of the day, everywhere you have an order, unless you're in New York with the ridiculous stuff that they're trying to do, or potentially California, at the end of the day, it still comes back to the business owners. So why don't, again, I say, why don't we emphasize to our business owners, why don't we work with our business owners? Why don't we direct it that way and not tell every individual out here who has, half of them has some reason why they can't do it. Let's put it on the business owners because that's where it's really at. And it's in their best interest anyway, because you know, y'all know my stance on it. We will never shut down again, period. We can do all kinds of stuff, but we will never pick winners and losers again, ever, my stance. But it's incumbent upon the business owners to protect their people and the people frequenting them.
Are we up at a general discussion now? Is Dr. Peak's participation, which was welcome, is that over? Is it time for us to generally discuss, or how do you?
Yes, I'm fine with that. That's a good question, Bruce. Let me ask if there are any more questions or comments directed towards Dr. Peak while she is still here. And then we can, you're welcome to stay, Karen, but we can at least discuss amongst ourselves. So, Nathan?
Dr. Peak, this is my last question. This is be a really quick one and probably an awkward one for you or an odd one for you because you're new. But have you, since you've been at the health department, have you ever had an elected official argue with you over any other health department policy? Have you ever had a city councilman call you up and tell you that you were wrong about the proper temperature to cook a chicken or keep a refrigerator or something at one of the restaurants when you're doing an inspection?
Since I've only been there 2 months in the administrator role, I honestly have not. I've worked as a nurse as public health and a epidemiology specialist, but other than that, I really haven't had the opportunity of anybody to do that. I don't guess I know where we're going with this question.
I was just wondering, I was just curious, this council hasn't gotten into public health issues a whole lot. So I was just wondering if it's common for elected officials to tell doctors and whatnot how to do their business, or if usually that works the other way around.
Yeah, well, the health department's a little bit different here because I have no authority. So trust me, if I had the authority, we would already have the mandatory face mask ordinance going. But I have no authority, so I have to talk to the city and county governments. Same things, what's happening with the CARES Act money, that money did not come to the health department. So yes, I do have to submit receipts and my requests to the county commissioner's office to even get any supplies that I need. So yeah, they are pretty much telling me what to do, which isn't right, but that's how our government's set up. The health department is a political subdivision. We're not even part of the Christian County government structure. So we're out on our own. We have a 5-member board that oversees me and that makes our decisions, and they're the overseer of our money. So we get contracts through the Department of Health and Senior Services that we have to fulfill. So we have like maternal child health contracts. And then obviously we do the communicable disease contracting. We have contracts to give immunizations, but again, we don't have any authority, should I say, but we take guidance and direction from a lot of people. So we can make recommendations based off of CDC and the Missouri Department of Health and Senior Services, but there is no authority that I have whatsoever. So I have to depend on our city councils, board of aldermen and mayors and presiding commissioners to help me in this fight as well, to do the right thing for our citizens. So, you know, just as a last thought, I know you probably maybe have another question, but I do challenge you to move forward with this and see if we can get these numbers down, get back to a normal sooner than later, because I'm afraid we're not going to get over this anytime soon if we just keep sitting back and not doing anything, especially not knowing, do we have immunity after we even get this virus? And then not knowing, when is this vaccine going to come out and is it going to be effective if it does? So this isn't going to go away, unfortunately, but at this point in time, we've got to do something because again, all of our resources are going toward COVID-19 and it's going to continue to go there until this stops. And I don't know when that's going to be.
All right, thank you. I didn't have any more questions. I just, again, thank you for being here tonight, and I appreciate all you're trying to do for the community.
Yeah, thank you.
Karen, thank you very much. I think we're just gonna open the discussion just amongst the aldermen. You are welcome to stay on. I am not trying to run you off, but at least one councilman would like us to discuss it amongst ourselves. So feel free to stay, but I'm gonna open it up to the council just for comments or questions. So
okay. I will excuse myself. I want to say thank you, and I'm very sorry. I don't know what happened with that code, but the second one did work. So I don't like to be late for meetings, but anyway, I finally made it, and I appreciate your time. And again, I do hope that we do the right thing for our community. Just keep in mind, we're never going to make everybody 100% happy. Whatever we do, somebody's going to complain either way. So I think you're getting both sides of it, just like I am. But at this point in time, this is all that we have. It's our last hope at this point, and hopefully to get our economy going in the right direction. And it's just a small sacrifice for each of us. It's not something we're going to do 24/7. It's not something we're going to do the rest of our life. It's just something that we have to do at this point in time to get past this and make our community stronger and keep our community healthy. So thank you.
very good, Karen. Thank you again, Karen, for dialing in. We appreciate your input very much.
Thank you, Karen.
You're welcome.
Mr. Galloway.
Okay, I wanted to hear the arguments against the mask ordinance, and I did. I listened very carefully to the questions that were being asked and the points that were being made. And that really has caused me to clarify where I stand. I want to go through the arguments that I heard. The first argument, that this isn't policy nationwide or statewide. That's just not the state of things. Policy for the state of Missouri are for the small subdivisions, the cities, to come up with policies during a pandemic. Policy is for the county health department to provide advice to us. And that was all set in motion by the governor's emergency declaration. So policy is for us to make decisions. That has been historically true. Towns have made quarantine decisions since the state of Missouri was founded. And you don't have to go very far back on Google to find where subdivisions did make those decisions back in the days where there was no such thing as a liberal in the United States, when influenza was going through the world. Kansas City and St. Louis, I read in a publication that was 2 years old, so before any of this began, they made their decisions, including banning public gatherings. So there isn't any reason as a matter of policy for us not to make a decision. That was clarified in my mind. The other argument that I heard was, and I do respect the people who make the arguments. I was just listening to the arguments themselves. Is, well, we don't know how to end an ordinance, that you can't trust the government to end it. Well, under policy, we're the government. We're it. We're the ones who make the decision. It's us. Anybody else in the government, it's us. I think that we had requested a city council, and the mayor was heading in the same direction, that we control this decision. I trust us to lift a mask ordinance when the time is right. I trust us because I know each and every one of you that's sitting here, and each and every one of you thinks with independent mind, and each and every one of you will say, now that we've hit that time. I had the same argument that was made about transportation and sales tax from another alderman who I respect, who's no longer there. And she had asked, well, how do you know that the transportation sales tax money will be spent on transportation issues? And I said, well, because I know me and I know the other people sitting on this board, and we're not going to let it go anywhere else. So I'm not concerned about when this ends. We'll make the right decision on when to end it. And that's part of our responsibility. The major concern that I had that was handled by the nurse was compliance. And for the social distancing, the way this theory works out, the way Dr. Peaks laid it out, and what I've read is, you layer behaviors to create a kind of a barrier for this pandemic to bump against. So social distancing is a major part of that barrier. Mask is another significant part of the barrier, and then hand washing also, and awareness as well, from what I've read. So, you know, these things are designed to work in tandem. And, you know, the question is, you know, if we pass a law, will we expect people to obey the law? I mean, is this going to be something where we create disrespect for the law? I think Dr. Peaks handled that pretty well. I think the behavior of our citizens is already spoken. I shop at Walmart. I get my medication there. I get my groceries there. So I'm there quite a bit. If she is saying that we're at about 100% on that, that's significant, because that was 40 to 60% of the population that I saw there that weren't wearing masks. They're wearing masks. And that is something that I hadn't thought of, is that people actually do obey rules. We're good people here. We have strong opinions. We may not like a rule, but we tend to obey them. That kind of dovetails with another thought that I had, which is 80% of our adult population gets in their car in the morning and leaves to Springfield, where there's a mask ordinance. Unfortunately, they're still shopping in Springfield. Wish we could get that sales tax revenue. But they're not protesting. 80% of us aren't protesting in the streets of Springfield against the mask. They're going to work, and they're still shopping over there. They're complying. I haven't heard of a compliance issue in Springfield, not yet anyway. So that was the thing that I was wondering about. And I think Dr. Peaks spoke to it. Now I want to talk about why I've been leaning towards this ordinance and why I think you should vote for it. There's no good reason not to. I'm going to say that again. There is no good reason not to vote for this ordinance. It's not even close. The people that, Alderman Smith, his family all wears masks. They believe in it. I wear masks now. Nobody here has said that they don't think that the epidemiologists are wrong about this. It's a theory, but nobody here has said, well, look, I'm a lawyer and therefore I think the epidemiologist is wrong. Nobody's saying that. History is going to look back on us. It's going to look back on us, and it's going to understand that we have clear choices. There's no policy issue that prevents us from making decisions. We're supposed to make these decisions. Historically, cities made these decisions. There isn't any question about whether masks are effective or not. Not really, not in the mind of anybody here that's sitting here, not really. And in terms of compliance, that was where I was wondering about. I think that our people are, for the most part, going to obey the law, and we're going to see compliance. And I think the evidence of that is just in the fact that 80% of us are already complying in Springfield, and the other percentage of us that actually shop in Ozark are complying at Walmart and where there is a mandate. This isn't close. History is going to judge us. We have all the facts in front of us. And the only thing that we're really concerned about is how people will feel about us making that decision. Well, we got voted here into this position because we're supposed to make decisions. That's what we're supposed to do. We're not always going to make the most popular decision. We have to make the ones right that count. We have to make the decisions that count, that are right. There's not another issue that anybody here on this board is going to vote on in their career as a city council person that is more important than this one? None. We are in a pandemic. Our state is in a state of emergency. Our hospital can only treat 10 serious cases. We can't wait for the numbers to get to the point where our system's overwhelmed. We've had a problem where people were masked and there were still infections. That is our reality. And so what I'm saying is, I go back to, there's no argument against this. There is none. Wearing a paper mask, this mask, doesn't hurt anybody at all. A community that is not wearing this mask is in danger of overwhelming its health system and is in danger of harming its economy and keeping its schools from functioning. So that is why I urge you to support a mandate. And if I sound adamant now, it's because I became adamant now, because I sat here and I listened and I realized there's really nothing to this decision. It's pretty darn easy. It just takes courage.
Thank you, Bruce. Other comments? Heather? Heather, then Jason.
I just have a question. If Ozark did vote for a mandatory mask ordinance, how does that affect the schools? Do they have to follow that?
Yes, it's my understanding from Ms. Callaway that they do have to follow. We have the overreaching authority in the city. There's a good possibility that they will do that before we do. They have also been wanting us to make a decision before they do, which would more than likely make their decision easier. But Nixa has already made their decision, Nixa schools. And my understanding is that the schools are just being overwhelmed with negative comments after the city failed to follow suit. But we're Ozark and we have to do what's right for us. Talk to Dr. Bauman today, and they'll probably be making a decision sometime next week.
And
I think it's fair to say that he anticipated that they would start school with a mask order.
And is that for all ages? And Rick, I'm sorry, but I can't hear you very well.
Okay, well, that's what I was afraid of.
Thank you.
I am sorry. I just, the public has seen me and I don't want them to think I don't support this. I talked to Dr. Bauman today and he indicated to me that they are moving towards the thought of a mask ordinance. That is a decision that will be made by his board, not by him. And there'll probably be a meeting sometime next week. But my understanding is that he doesn't see how they can start school without it because they can't socially distance.
And what ages? Would that be all ages?
That I don't know, Heather. I don't know.
Okay, thank you.
He may have told me, but I don't remember what he said. So,
Okay, thanks.
all right. I'm sorry if I'm hard to hear. Anybody else have any comments? We're not in any hurry here. We want, yes, Jason.
What I'm trying to say is that I view government as to be more along the lines of, as I mentioned, educating, assisting, recommending, working with private business. I don't want to see the city take a role of dictating, demanding, punishing for those who don't comply. I do not accept that the mask question is as simple as Bruce sets forth. I think there are questions as to its effectiveness and questions as to its level of effectiveness, I guess I should say. I think we certainly can recognize that there's a general public dislike for the idea, at least 50%. I would imagine, and it's my opinion, that the 50% who oppose the mask feels more strongly than the 50% who support the mask. And what I mean by that is public discourse. You know, you're going to have people who are going to be upset either at the establishments or possibly protesting. I'm just saying What I'd like to see is the city's already begun an education program, which I think was very well put out. Who are you masking for? It's been going on for a little while, and I think that's being beneficial. You're seeing private businesses such as Walmart and other large companies step up and enforce their own mask policies, which is fine because those are private companies on private property asking their patrons to comply. It doesn't involve the government. I think what we have to understand that what we're really voting on, or what we're suggesting, is that we're going to find it, you're either going to punish people by fines or incarceration for not adhering to a mask policy that half the population doesn't agree to. I didn't hear Ms. Peak or Dr. Peak indicate how, certainly she said it's not a cure. If I wear a mask, I can still get the virus. I didn't hear much information as to how long an unmasked individual in a public establishment, when exposed to another unmasked individual with the virus, the likelihood of infection or that type of information. I'm sure it's not 100%, but I didn't get any of that information. I think there's a lot of unknown questions. It certainly is easy to say putting a mask on doesn't hinder or doesn't affect or doesn't adversely affect people, but I would think there's a good portion of the population who have, even if it's not, they have a personal grievance. They view it, we don't like to think of it as, we want to think of it as a health question. I think we have to recognize that currently in this county, it's a political question as well. And when the city, who's already struggling to maintain a positive relationship with the citizenry, with its citizens, where some citizens are angry with us for a variety of reasons, that we somehow keep wanting to poke the bear and antagonize a good portion of this community further and further. And I'm asking for us to pause, to continue the educational process, to assist the public, if that means providing them access to masks, so be it, and see if we can be more cooperative with the citizenry, try to increase that voluntary mask commitment without issuing an ordinance. Because I think once you issue an ordinance, people are going to stop listening to the education program. And those who don't want to wear a mask are going to be still stronger than ever, committed to not complying. Perhaps not all of them, absolutely, but I am one, again, who like to see limited government. And in times of crisis, it's easy to try to please or try to fix everything. And I'm just saying sometimes every good idea doesn't need to be an ordinance. Sometimes we still need to have faith in the community that they're going to do the right thing without forcing or compelling them to do the right thing. I certainly am still opposed to the ordinance. I still think it's a bad idea. The city of Nixa, in a very similar position, not far from us, who we usually rely on for guidance in these type of matters, who we work with together on many things, voted not to have a mask ordinance 6-0. So it's certainly not as clear cut as I think we all think it is. I think there is still room for differing opinions, and I certainly do not feel shame or humiliation to stand up and say I oppose this mask ordinance on the basis that I think it's more than the government needs to be involved with at this point. And I don't want to compel my neighbors or to threaten or punish my neighbors if they don't do what I think is best for them. It's a decision I think that would be better served if they reach that conclusion on their own. I do understand that there are many aspects of government that we get involved with for public safety. I do get this, but when we start talking about someone's how they take care of themselves, there's many things that the government could try to outlaw, such as some cities try to outlaw sodas, for that example. There's many aspects of human life that people can improve upon that will save lives. It's just a question of, what are those barriers or limits for the government to do? What should we be involved in and what we shouldn't be involved in? We could outlaw smoking, but we don't. We could outlaw drinking, but we don't. And you certainly could compel people to wear masks, and I'm asking you, not to do that either.
Thank you, Jason. All right. Any other comments? Then Mr. Smith.
Thank you. The only thing I want to say, and again, to understand where this is coming from, the CPA, but the question of the remdesivir only having 10 doses in Springfield would not surprise me, since the FDA has not approved it yet, and it's only being tested. It's not sure that it works according to the FDA, but it's in an investigative stage right now, and it's been authorized for emergency use for severe COVID cases in limited controlled environments. So my point being isn't that it doesn't, my point being is that doesn't mean that we don't need resources. My point being is if somebody's going to stand there and say that's all we can do, I would say they need to probably go back and look at their data. I don't think that's an appropriate use if the FDA has not approved it yet for COVID. So that wouldn't surprise me also if there's only 10 doses, but just like the media, just like us, just like everybody, we can take things and present it in such a way that, you know, benefits us. So I'm not saying that's what they did. I'm just saying it wouldn't surprise me under the circumstances that they only have 10 doses of it. But I certainly would not view that as a limitation. If you look at the CDC doesn't specify any specific drug treatment for COVID-19 at this point. So if we're using them as our source and guidance, I just think it's small. The argument doesn't make sense to say we can only do 10 because we only got 10 doses of a drug that's not even approved by the FDA.
Okay.
And remember where that's coming from, the CPA. So take it with a grain of salt and verify it yourself. But
Posted.
Yes, sir. I'm probably just gonna echo some of Alderman Galloway's sentiments from earlier. I'm having a hard time. I've now watched half of Springfield's public hearing. I watched 4 hours of Nix's 5-hour public hearing, and I watched about an hour and 20 minutes of Branson's. I feel like I've gotten a pretty good grasp on the arguments that are out there. I'm always looking for a new one. Somebody's got one. And at the end of the day, I still keep kind of landing where Alderman Galloway was, that, you know, the government's not that complicated. People ask some people to do them a job, they throw a little money at them to do the job, and we go hire some people to do it. It's that simple. It's just really not hard. And there's a number of professionals at various levels of government that we have hired to do a job. And for many of them, that now they're getting to do it. And we've decided that now we don't particularly like those experts. I'm not sure next if we start arguing with engineers about the proper size for sewer pipe or how to build roads. I don't know what comes next for government, but I certainly not a road that I want to go down. I think it's our duty to vet to vet the experts that we bring before us, to verify that they're of upstanding character, that they're going to do their job well, that they're going to rely on sound data and their peers to double check it. It's not our job to go out there and actually do research. I'm a software designer. I'm not researching COVID, but I will make sure that the people I listen to are credentialed and respectable and trustworthy. And we've done that. We've done that as a government. We've done that as a government at multiple levels. And whether that is the Christian County Health Department or the State Health Department or some of our federal organizations and even in NGOs, we're getting a lot of push, encouragement, pressure, whatever you want to call it, to do this from health professionals across the country. And for some reason on this issue, we just have decided that we do not want to listen to people that know what they're talking about. For me, I think that this is a bit of an issue of compassion. Maybe this is the planning and zoning side of me talking a little bit, but I think your laws ought to reflect the character of your city and the people that live there. And regardless of where a person stands on the mask ordinance, it seems like every comment I have heard people say includes a little caveat that that they care about their community. And at some point, we have to stop just giving lip service to things that sound good and actually be people of character and and stand up for these things. If we are a community of caring individuals, then our law ought to reflect that. That's all I have to say.
All right, thank you. Anybody else? We'll stay as long as we need to.
I do want to get into one.
Yeah.
I wanted to comment on Alderman Smith's point. Our current president bought the entire world supply of Remdesivir, all of it. He's laughing because I sent him the article. And we've bought 90% of future production for next month and the month after. So we only got doses enough for 10 in our part of this country. But apparently the United States has taken the position it's an important drug. I'd just point that out.
All right, Mr. Childers would like to make some comments. Steve?
I really only just have one. I wanted to answer Alderman Alder. You asked a question about if the school would be passing that. If they passed a mask order, would it be for K through 12? Yes, Dr. Bauman said it would be required for K through 12. So the whole group. Just wanted to get rid of that in.
All right, any other comments? All right, I guess if not, then we will adjourn the meeting. I want to tell you that the Mayor Pro Tem Smith, myself, Samantha, Amanda, Steve will be meeting tomorrow morning. We're going to determine the protocol for how we're going to handle the meeting Monday. But Monday it will be public comment, and I'm hoping that it will be an in-person meeting, but we're going to this meeting that it will be held physically here at City Hall or at the OC, I should say. It's a bigger meeting room, but we'll let you all know how that pans out. But thank you very much for your comments, for sticking with this. We've got a lot of time before next Monday night. So be listening to your constituents and listening to the facts that you see and hear in various news media, and of course take that with a grain of salt. But that's all I have for tonight. And let Steve go ahead.
I do just want to mention that we do have a draft order. It is a draft ordinance that we've had that was very similar to what the city of Nixa was considering. We want to provide that to the Board of Aldermen so that the Board of Aldermen can suggest any amendments or modifications that they wish to have for that. So tomorrow we will be discussing the process for getting that out in their packets. And when we do that, obviously that will be a document of public record once it does go out. And so certainly the public will get an opportunity to look at that as well. So I just wanted to make that mention that if this is something, an ordinance that is sponsored by any one of the aldermen and it does go on the agenda for August 3rd, again, there will be a draft ordinance that the public will be able to respond to.
Well, let me make something very clear on that. It is my intention to bring forth an ordinance for a mask mandate that is not because I necessarily am in favor of one. It's because I think we need to deal with it head on. We need to put it on the table and we need to let the public know where we stand. And I think that we do have a member of the Board of Aldermen that is willing to sponsor that. And so it will be like any other first reading bill. We will discuss it. There will be public input, and I suspect there will be a lot of public input. I also suspect it won't all be friendly, but we have to give them the right to hear. Now, when that is all over, we will have our typical choices, okay? When I close the public hearing and close council comments, several things can happen. There could be a motion to move it forward, but if it is voted on, it can be voted in favor or against. Somebody can also make a motion to table it. I don't know what's going to happen. At this point, I don't have a preference, but I'm wanting to move this forward so that we can simply take a stand. I think the city The public deserves that. So that's where I stand on it. I just want everybody to know, and I appreciate your comments tonight. Is there anything else before we adjourn? All right, do I hear a motion to adjourn? Somebody raise a hand. Mr. Smith, a second, Mr. Poston, and Mr. Galloway. Thank you very much. I'll see some of you in the morning and the rest of you Monday night. Thanks again. Oh, you've been hiding back here.
Yeah.
Oh, you know what we forgot?